In order to perform a dry dressing change, I must first review the order on the prescription. The order says to cleanse the surgical incision site with sterile normal saline daily and dress dry gauze. So once I verify the order on the prescription, then I can gather my supplies. So the supplies that I'm gathering today are my dry dressing change, my clean gloves, my tape, and my sterile normal saline solution. And for the sake of this video, I already set up the waste disposal bin on the side of the bed. And so once I do that, then I can perform hand hygiene and enter the patient's room. I can start with my introduction and say, hi, my name is Cerise. I'm a nursing student year 2. Today I'm just going to be doing your dressing change in order to promote the healing of your wound and to prevent any infections. Everything said and done here is going to be confidential between me, you, and your healthcare team. It's only going to take less than 5 minutes, and it is going to require a little bit of touch around your wound. Is that okay? Once I obtain consent, then I can provide privacy and I can ask the patient for 2 identifiers. So can I get your name and your date of birth? And then I can ask the patient if they have any allergies, and I can assess their level of pain and comfort using a pain scale of 0 to 10. Then I can prepare my aseptic triangle, which is already prepared here. So the patient is over here, my workspace is over here, as well as my waste disposal, which is on the side of the bed. Then I raise the height of the bed to a comfortable working position, and then I undrape the wound just in case the patient has a gown on or anything. So I undrape the wound and the old dressing is still exposed on the wound here. Okay, now I can perform hand hygiene and put on clean gloves. Like so. So once I put on the clean gloves, then I can take off the old dressing parallel to the skin of the wound, and then parallel to the growth of the hair so that I'm not pulling on the skin and the hair, and I'm going to pull towards the incision so that it reduces any pain. Once that's done, then I can inspect the wound. So here you can see that the drainage is serosanguinous. This means that the wound is still fresh and drainage is still being produced, which is a normal finding. Purulent would mean that the wound is infected, so you want to avoid that. I see that there's no tunneling or undermining, which means the skin is still intact. There's no foul odor that can indicate any infection. So once I verbalize all of that, then I can dispose of the dressing as well as my clean gloves. Oops. Okay. I perform hand hygiene for 15 seconds, and then I can open my dressing change, my dressing shirt. Put that inside, and I can touch my 1-inch border with my clean hands, and I can touch this as long as I don't touch the tips of the tongs. Then I can take everything out with these tongs. This is the drape, sterile, aseptic gloves, and then my sterile tweezers. My dressings are still going to be left in there. Since my normal saline was not part of the kit, then I will pour my normal saline before I put on my gloves. I will hold it at the label to make sure that if any splashing occurs, then it will not hit the label and ruin any of the writing. So I pour it and reduce any splashing, and make sure I don't hover over the workspace. Then I can put on my sterile gloves, my non-dominant hand first. I can now touch everything in the aseptic workspace So I would drape the patient, but since these are too big to fit on my desk, then I'm just going to verbalize it. Once I open this, there is going to be a matte side and then a shiny side. I would place it shiny side down. And then I can prepare cleaning of the wound. So I will take my gauze and I will put them into the sterile solution and wring them out with my tweezers to prepare for the cleaning. So once that's done, then I can take the gauze and wipe from the top to bottom, from directly over the site, put it in the waste disposal, distally from me, and then proximally. Once that's done and cleared, then I can take a 4x4 and pat the area dry, knowing that it's moist from the normal saline. Since we are putting on a dry dressing today, so I'm going to put that into my disposal bag, and then I will apply my 4x4 dressing. But as you can see here now, the incision site is now clean and free of any drainage. Okay, make sure that I maintain sterility, and then I can take my 4x4, place it on top of the wound, and then I will tape it down on each side. Quickly, for the sake of the video, maintaining aseptic technique. Now that the aseptic procedure is done, then I can remove the drapes from the patient. Then I can remove my gloves, perform hand hygiene. Then I can help the patient into a comfortable position, lower the head of the bed and secure the side rails, and make sure that I clean everything up into the waste disposal. So everything in this kit I would dispose of and then put everything away and clean it up. After that, I would ask the patient if they're comfortable and will notify them where the call bell is, so if they need me, then I will be here to help them. Then I would leave the room and perform hand hygiene and document. So what I would document is the appearance of the wound, which I did verbalize before. I would talk about any changes in the wound appearance, and I would say that it is improving, or if it was not improving, then I would indicate that. I would talk about the type and the amount of dressing applied. So we used a dry dressing, and we used one 4x4 dressing that we taped and secured to the wound, as well as the patient tolerance, if they had a lot of pain, and the reaction to it based on if they had an analgesic beforehand or anything. And then sometimes in some agencies, they would require you to write on a piece of tape the date and the time in which your dressing was changed, and then they would tape it right on the dressing so that nurses can keep track of when to redo these dressing changes. And that would be it for the dry dressing change.